Welcome back. Thanks for staying with us. A group of 40 unemployed post-community service doctors are demanding answers from the Eastern Cape health authorities. The group was left out from the initial recruitment process that took place at the end of March. Now, the unemployed doctors say since the March intake, there has not been any progress on the recruitment of those left behind. They say they're puzzled because the Provincial Department of Health received 380 million rands from the national government for the recruitment of the post-community healthcare workers in the province. They say they have inquired about the matter and have been ignored. There were initially 138 unemployed post-com serve doctors in the Eastern Cape. Let's get some reaction now. We're joined by one of the doctors seeking employment, Dr. Mava Mazeka. Very good evening to you. Thank you so much for your time. You're demanding some sense of clarity from government after being left out of an employment opportunity. It's a puzzling situation. What challenges are you grappling with?
Good evening, ma'am, and good evening to the listeners as well. It's quite concerning and it's quite distressing because the challenges that we are dealing with obviously is mostly the unemployment, and we've got a challenge whereby we need to take care of our families. And at the same time, having myself worked in the 3 years now, I am much aware of as and other health as in the province. I've been to multiple different hospitals, and it is a common thing to see a shortage. So it's quite concerning for us to be left out because 40 is such a huge number. If I may just give a story. What happened was initially there were a total number of 138,000 that we then submitted a memorandum here at the shop. That was back February. A memorandum received, signed,
Dr. Mazeka,
and told that
I'm hoping that this line will perhaps hold a little longer, but you are breaking and it's very difficult to hear you. Perhaps hoping to get back to you in just a moment as we try and establish a more solid link there, because we are really battling to hear you, and what you have to say is important. So we will be getting back to you in just a moment. Right, let's take you back to the conversation we were having with one of the group of 40 unemployed doctors who are demanding answers from Eastern Cape health authorities after being left out of an initial recruitment process. Joining us to expand on this discussion is Dr. Mava Mazeka, who says he's been left out. Dr. Mazeka, before we got cut off, you were talking about the challenges you're facing and the questions that you're grappling with as you try and get a sense of why you've been excluded. What action has this prompted you into now? I understand you've been picketing and staged a picket outside the hospital.
Good evening again, ma'am. As I've already said, I'm Dr. Mazeka, and I'm currently with my colleagues here outside the offices of the Department of Health here in the Eastern Cape at Bisho. And the reason we decided to take that initiative is because of the pressing matter of unemployment as doctors. And it's not just the pressing matter of unemployment, but what's alarming is that the funds are also there. And we have been assured by the department that the funds are there. But if I can take you back in February, we first wrote a memorandum and submitted to the department, and they promised to respond within 14 days. They failed to do that, and then we followed up towards the end of March, and then that is when now they decided to release a block advert of about 138 posts for the doctors. And of note is that we were also 138 on that list. But when it came time now for the recruitment process, they only recruited a certain number that they do not want to disclose to us. And then after that, we were left out, and we were promised that no, since it's close to Easter, because the recruitment started on the 26th of March, so we should go and enjoy the Easters, and then the recruitment will continue after the Easters. We should not worry because the budget is there.
and there's nothing to worry about. But we came to find out that after the Easters, no one was coming there contacting us, even though we had applied for the job. We did not get interviews, and when we called the office, we would not get any answers. And up until now, we then decided to come straight into the offices to come and demand answers. But unfortunately, we've been here since Monday, and we are not getting any reasonable answers. No one has been able to tell us exactly why have we not yet been recruited. And what we found when we got here as the doctors, we found that there were nurses who were here also coming to complain about the same issue, and there were also pharmacists. But from the nursing side, it was sort of a different story in the sense that from their side, we found out that the recruitment had started for the nurses, but it was only for the bursary holders. And there was a letter that was circulating that had been signed by the department that the recruitment is only for bursary holders, whereas on the advert, it does not state that it is for the bursary holders. And then with the pharmacists, we found that they had delivered a memorandum also on the 15th of April, but the department had failed to respond. And when we arrived here, we've had multiple meetings, including with the HOD of HR, the Human Resource Manager, and also Labor Relations Manager. But as we sit here now, I don't know if we are going to be employed. I am not sure, and I don't know the reasons. So the challenges we are facing now is that we are in the dark. We are not even given the answers, but we know that the money is there. And the MEC went on a public platform and said that there are no post-concept doctors that are unemployed in the Eastern Cape, not even one. But outside here, I'm sitting with my colleagues, and they have the list of the unemployed doctors, of 40 doctors. So it is quite concerning because they are not being transparent with us. And it would be at least better if they were transparent with us.
What would you like to see happen from this point onwards? I mean, you're talking to us about your frustrations and a lot of confusion because there are many grey areas as you try and get a sense of why you've been left out. What sort of action would you like to see take place as you sit out there and hopefully get some sort of way forward, or perhaps even a sense of accountability as to why you were not included?
Yes, ma'am. It would be nice to get a sense of accountability or reason behind the process, because it would be understandable maybe if there were interviews that were conducted and maybe they said no, after the interviews we decided that no, we're not choosing you, but we were not even given that opportunity of going for interviews. So and when we try to inquire, we are not given answers. So that is very frustrating. So what we would like is we would like to be given answers, but at the same time we would like to be employed, because we are assured that the budget is there and we should not worry. But they keep on making us wait and they are not giving us answers, and it's quite frustrating. Yeah. So I would say at most what we want is answers, and then we want employment, so that we can go and serve our people back in our community.
Dr. Mazeka, there's been a lot of reaction to a recent claim by the health department that young doctors often reject rural employment and that several vacant posts are in rural areas. What is your reaction to that? Do you think that there is an opportunity for you, as you have been promised that there is an opportunity for you? And is there any sort of challenges around the area of doctors working in rural areas?
If speaking, as I'm speaking and sitting here right now with my colleagues, there's not a single one who has rejected a post from the rural areas. And the department has not offered us any post in the rural areas. And me, myself, having grown up in the outskirts of a small town called Bizana, there is no way I can reject a post from the rural areas, because I am from there. That is where I was born. That is where I was raised. So if I am rejecting employment from my place of birth or from the areas where the people are, because the most important thing about health is not just providing the service, but it's also taking the service to the people. So I don't understand the concept of rejecting posts in the rural areas. because that is, to me, it's counterproductive. As I'm sitting here with my colleagues, none of us have rejected, and I don't think there's any one of us who will reject a post, because what we want is to work. As regards to the challenges working in rural areas, I have worked in rural areas because I have worked 3 years already in the province. Some of the challenges I experienced as a doctor is that when you are working in rural areas, you find that maybe the roads are not good enough, and you find that the ambulances take long or to come and fetch the patients. But it's logistics like that in rural areas. Otherwise, other than that, I wouldn't say there is something that is a good enough reason to prevent someone from going to rural areas.
Dr. Mazeka, let's thank you for your time and hope that your cries for help will be heard. We would like viewers to note that the late edition had reached out to the Eastern Cape Health Department and invited them to join this discussion. They, however, failed to respond. Late edition remains open, of course, to affording the department their right of reply.